Uh, Hi. I guess, yeah, everything is working here. So welcome to the Body System 3 Cardiac Anatomy. And today we will be speaking about, yes? Yes, this is the live. So welcome again to the Body 3 Cardiac Anatomy. And today we will be speaking about the upper limb. So, let's go ahead. I will start with the basics that I've been showing you since our first lecture. So, let's revise this material because the upper limb is, upper limb branches are, arteries branches are coming from these outlines, let's say like that. So once again, here we're having the left ventricle, and from the left ventricle we're having the aorta, we're having ascending arch and then descending / thoracic aorta that we already discussed, and we also discussed the abdominal aorta, right? And from the arch of aorta we are having brachiocephalic arteries, we are having left common carotid artery, and we are having left subclavian artery, right? And from brachiocephalic, we are having right subclavian artery and right common carotid artery. So right subclavian artery, left subclavian artery, we've also discussed that. However, we will continue this branch of discussion with the blood supply of the upper limb. So, on this photo, I provided mostly the schematic overview of our blood supply, and it will be more easier for you to understand it schematically. So again, as I already mentioned, why this roots matters here, because for example, we're having brachiocephalic trunk, then right subclavian trunk, and after that we're having right axillary, right brachial, right radial, and ulnar, and digital arteries. So these are the branches that mostly we will concentrate on today, but we'll start from the posterior scapular area. However, by schematically, this is the blood supply that it is important for us on this lesson. So yeah, the outline of this scheme is really well and is really easily understandable for you to study and revise the material. So, let's start with the posterior scapular region in the anatomy first. On the first semester, as I remembered, you already started where the scapula is located and what functions it is having and all the muscles it is having. However, now let's discuss like the arteries. So, 3 major arteries are found in the posterior scapular region, and these ones are suprascapular, posterior circumflex humeral, and circumflex scapular arteries. And these arteries are interconnected to each other and giving us the blood supply of the scapula. So here on this photo you can easily see several arteries. So I mentioned suprascapular artery, which is this artery here, right? Then I mentioned posterior circumflex humeral artery, this one. Also, we're having the anterior circumflex humeral artery, and they are anastomosing with each other. And also, I mentioned circumflex scapular artery, this one here. So, all these 3 arteries, in this case, I'm counting circumflex humeral artery as an anterior and posterior as one artery. We are having 3 major arteries that is supplying our posterior part of the scapula, right? So, Suprascapular artery, it is the major artery that we mentioned, and it is originating in the base of the neck as a branch of thoracocervical trunk, which in turn is a branch of subclavian artery. Do you remember this part, or let's go back and from previous class and discuss this part? Yes or no? Some said yes, some said no. So just one, I will just show you where it is located in the PPT, and we can go through it. So if you remember, like this part, a right subclavian artery, it is the branch of it. And if you are seeing here, right? So this is a right subclavian artery, and we are having a thoracocervical trunk, right? This part here. This minor part here. And after that, it is branching and giving us suprascapular artery, which in sense it is part of thoracocervical trunk, and in fact it is branch of subclavian artery. Okay, back to our topic now. Also, like suprascapular arteries can originate directly from the third part of the subclavian artery, so we kinda can miss the thoracocervical trunk, and just right ahead from the suprascapular artery it can come out. It is also, apart from the scapular bone, it is also supplying supraspinatus and infraspinatus muscles. And also it is branching and contributing the branches by its roots. Okay, so this is again the same photo that I mentioned to you. So we are having right subclavian artery, then branch is here, thoracocervical branch, and after that it is divided and giving us the suprascapular artery, right? So you see next photo here, again we're seeing here subclavian artery, and here up there we're having like cervical trunk, right? And from there we are dividing and it's going straight to the posterior surface. However, suprascapular arteries going into the axillary region, and we're having axillary arteries there, right? Another artery that we are having, it is posterior circumflex humeral artery, and it is originating from the third part of the axillary artery in the axilla. So it is originating from the axillary artery, which is branch of subscapular artery, right? Okay. Yeah. The posterior circumflex humeral arteries leave the axilla through the quadrangular space in the posterior wall, and they are entering the posterior scapular region. And mostly what they are supplying, it is glenohumeral joints. And as you see on this photo here, we are having several, like these arteries mentioned. So see, these are our posterior and anterior circumflex humeral arteries. And this big artery that you're seeing, it is like the axillary artery, and it is branch of, in this case, right subclavian artery, right? Okay. So next artery that we will be discussing, it is circumflex scapular artery. That it is branch of the subscapular artery, and this is the largest branch of the axillary artery. that again it is originating for the third part of the axillary artery in the axillary region. And again, to see this photo back, we mentioned this part, right? Circumflex scapular artery. And as you see, it is coming from the subscapular artery. And subscapular artery itself is the branch of the axillary artery. So before going and discussing the vein, let's sum up what we've studied in this part. So we are having the scapular supply. It is consisting of subscapular arteries, anterior and posterior circumflex humeral arteries, and circumflex scapular artery, right? So suprascapular artery is a branch of thoracocervical trunk, which is coming from right subclavian artery, right? Then from the right subclavian artery, it is going and becoming axillary artery. And axillary artery is giving us two main branches. One main branch, it is straight ahead coming from it, and it is circumflex humeral artery, and we're having anterior and posterior, and they are anastomosing. And we're having another major branch. It is subscapular artery that again it is dividing and giving us circumflex scapular artery. Clear this part? Do you have any questions? Okay, no questions, then we are going forward. Okay, let's talk about the veins, right? We've discussed already the arteries, and let's talk about the veins. Veins in the posterior scapular region generally follow the arteries and connect with the vessels in the neck, back, arm, and axilla. And they are having almost the similar names too. Okay. Talking about the axillary artery. As I mentioned, axillary artery, it's a continuing part of our main branch, and it is like the right or left subclavian artery, right? It is passing through the axilla, and they are aware with the major vessels, nerves, and the lymphatics of the upper limb. Axillary artery is supplying the walls of the axilla and its region, and it is branching and also supplying the glenohumeral joint and the scapula. And mostly, at which point the subclavian artery is becoming the axillary artery? That is kind of quiz question. At the lateral margin of the rib number 1, and then it is passing in the axilla, and from this point we are calling it the axillary artery, and after that point it is becoming the brachial artery, and brachial artery is becoming from the inferior margin of the teres major muscle. So to see next slide here, we can see what I discussed. So as you see, we are having subclavian artery. At the lateral margin here of the rib number 1, we are having already the axillary part, right? Axillary artery. And axillary artery, as you know from previous class, consists of the first part, second part, and third part. And from the third part, we are having mostly like divisions that we already mentioned today. And after that, we are having like at the lower border of teres major, we are having brachial artery. Okay? Do you have any questions regarding this? So subclavian artery is continuing, and at this level we finished at the brachial artery. So as I mentioned, axillary artery is separated by pectoralis minor muscle, and they are crossing anteriorly to the vessel, and this gives us 3 parts. And that's why this is the muscle, and as you know, it is crossing above what I mentioned, and it gives us 3 parts, right? First part, it is like proximal part to the pectoralis minor. Second part, it is posterior to the pectoralis minor. As you see, the muscle is above it. And third part, it is like distal to the pectoralis minor. So once again, to see more in 3D, here is this photo. This is our subclavian artery. At the rib number 1, it became axillary artery. And from the teres major, it became brachial artery, right? And this is our pectoralis minor muscle. It is halfway cut to better see the axillary artery. And it's 3 parts. First part, it is above the pectoralis minor. Then beneath the pectoralis minor, we're having second part. And after that, we're having the third part, which is below the pectoralis minor. I guess with this picture, you can easily understand and have the idea how it is anatomically located, right? Okay. So this is the same photo once again. And now talking about the branches of the axillary artery. One of the branch of the axillary artery, it is superior thoracic artery, which is originating from the first part. We will see the photos of that, don't worry. Two branches of thoracoacromial artery and the lateral thoracic artery, they are originating from the second part. And 3 branches of the subscapular artery. Anterior and posterior circumflex humeral arteries are originating from the third part. And we already discussed like the third part originations in sense of the posterior scapular blood supply. So let's now see the first part. So as I mentioned, this is our subclavicular artery. And here is rib number 1, right? Do you see, guys, with the mouse? Yeah. After that, we started the first part of the axillary artery. And as I mentioned, we're having superior thoracic artery. And this branch is here located. Then we're having beneath the pectoralis minor the second part, and we are having their branch, it is like thoracoacromial artery, right? And that's the third part. We are having subscapular arteries and anterior and posterior circumflex humeral arteries. Okay. Do you have any questions regarding that? No. This is the posterior overview. We already discussed this photo once again to just see and memorize the arteries, because I'm hoping after our class, when you leave the classroom, you will be able to recognize these arteries really well. That's why I'm repeating it much time. Okay, so now let's continue and discuss like the first branch of the first part of the axillary artery, and this is superior thoracic artery. And as you already saw, and we will see once again, superior thoracic artery, it is small branch and originates from the anterior surface of the first part of the axillary artery. And what's important, it is mostly supplying the medial region, like serratus anterior. Also anterior part, pectoralis major, subscapular, and pectoralis minor muscles. And these muscles are contributing like the medial and anterior axillary walls. And to see on this photo here, so this is the artery here, superior thoracic artery, and it is supplying like the major and minor pectoralis muscles here. It will be located here, right? Here. And also it is supplying the serratus anterior, which are on the medial walls. Another our branch that's coming from the I missed something. Another branch that we will discuss now, it is a thoracoacromial artery. And by the name, I guess you can already understand what location it can be, because it is thoracoacromial artery. And also, this is the short branch, and it is again originating from the anterior surface of the second part of the axillary artery, just posterior to the superior margin of the pectoralis minor muscle. And it is supplying mostly the it is penetrating actually to the clavicopectoral fascia, and then it is dividing into its 4 branches, and we're having branches of the pectoral, deltoid, clavicular, acromial branches, and they are supplying mostly the anterior wall of the axilla. So by the its branches, you can tell which exactly muscles they are supplying, as we are having the branch for the pectoral, meaning that pectoral muscle will be supplied. We are having branch for the deltoid, and it will be supplying the deltoid muscle. We are having the branch for the clavicular, so it will be supplying the clavicular muscle, and also acromion branch, and it will be supplying the acromion part. So here, on this photo, this is our thoracoacromial artery, and as you see, we're having like 4 heads here. These are the 4 branches that we will be talking about, and by location you can say which branches we are going. For example, acromion, deltoid, right? And it is supplying mostly the whole anterior surface of the axilla. Yeah. Now let's continue with our lateral thoracic artery. And our lateral thoracic artery, again, it is arising from the second part of the axilla on its anterior surface, and also posterior to lateral margin of the pectoralis minor. It actually follows the margin of the muscle to the thoracic wall, and it is supplying the medial and anterior walls of the axilla. And in women, it is creating the blood supply for the breast also. Yeah, so let's see on the photo where our lateral. So here, this one, this small one, it is supplying like the whole anterior part of our pectoralis major muscle and the breast. And as you see, it is coming from the below of the pectoralis minor, like it is coming from the posterior and then coming below the pectoralis minor muscle. However, thoracoacromial artery, it is originating from the back of the pectoralis minor but going upwards, because it is mostly supplying the anterior part of the axilla, and this is supplying anterior and medial part of the axilla also, and in women the breast. Okay, so if you couldn't see with the mouse, like this is the branches and this is the branches here. Okay. Another branch that it's really important, it is subscapular artery. And subscapular artery, it is the largest branch of the axillary artery, and its major blood supply to the posterior walls of the axilla, which consist of the subscapular wrist muscle, latissimus dorsi, teres major, long head of triceps brachii. So mostly the huge muscles that we're having and are taking part in the movement of our scapula and arm is supplied by subscapular arteries. And also subscapular artery, as we already saw on the first slide, it is creating the blood supply for the scapular bone and the region, right? So subscapular artery, it is coming, like originating from the posterior surface of the third part of the axilla, and as I mentioned already, third part of the axilla was below the pectoralis minor muscle, and it follows the inferior margin of subscapular muscle for a short distance, and then it is dividing into two branches. And one of the branch it is circumflex scapular artery, and another branch it is thoracodorsal artery. And now let's see the photo for it. So this is like our third part of the axillary artery, right below the pectoralis minor. I've showed with the mouse, and now I will show you here. So this is our subscapular artery, and one of the branch it is like circumflex scapular branch. Like even the name implies that it is circumflex, it is round, right? Roundness means circumflex, around something. And another one it is like thoracodorsal artery, and it is located here, more on the anterior surface, and it is going on the posterior surface, right? Okay. So let's see another photo where, so it is like, as you see here, it is like the, as it is like more in light color, it is in front, and from the backwards we can see how it is coming around and supply the scapular bone, and this is like this branch here, it is circumflex scapular artery. And this one here, it is coming down to thoracodorsal. Like this one will be scapular circumflex, like this one, and then branching. And this one will be thoracodorsal. Clear? Okay. So, now let's discuss more in details our anterior circumflex humeral artery. And anterior circumflex humeral artery, it is coming straight ahead from the axillary artery, right? Mostly the third part here. And it has like anterior and posterior, and it's supplying anterior part also and posterior part. So anterior circumflex humeral artery, it is small compared to the posterior circumflex humeral artery, and it is originating again from the third part of the axillary artery, and they both are originating from the lateral side, so they are coming around and anastomoting between each other. What they are supplying? They are supplying the surrounding tissue, and it includes the glenohumeral joint and head of the humerus. So on this picture we can see like the axillary artery third part, and this is like the posterior circumflex humeral artery, and in lighter color you will be able to see the anterior wall. And as you see here, we are having quadrangular space. So whenever on the quiz there will be question where the posterior circumflex humeral artery is located, there might be quadrangular space also mentioned, right? And this muscle, it is latissimus dorsi, and it is above the latissimus dorsi, right? Okay. Now let's talk about the posterior circumflex humeral artery. Posterior circumflex humeral artery curves around the surgical neck of the humerus. If you know, we're having anatomical neck of the humerus, and beneath that we're having like the surgical neck of the humerus. And posterior circumflex artery is curving around the surgical neck of the humerus, and I'm highlighting that because it is really important for the surgeries. And it is supplying the surrounding muscles and surrounding muscles, I already mentioned what we're having there, and also the glenohumeral joint. And as I've already mentioned, it is anastomosing with anterior branches of the circumflex humeral artery. Plus, it is also anastomosing with the branches from the profunda brachii, suprascapular and thoracoacromial arteries. So they kind of are creating a plexus there, right? Okay. Now, let's discuss the veins, and I will go faster with the veins because like we're having almost the same names there, and the locations are the same. The axillary veins pass through the axilla medial and anterior to the axillary artery, and they are becoming the subclavian veins as the vessels cross the lateral border of the rib 1 at the axillary intel. So the name implies the same, locations imply the same, everything is same. So tributes of the axillary vein generally follow the branches of the axillary artery, and other tributes consist of, like, they include brachial veins, and they follow the brachial artery and the cephalic veins. So to see this photo here, we are having paired brachial veins. Then it is becoming, for example, a basilic vein, right? And it is becoming the axillary vein, and it is going to the subclavian artery, right? Sorry, subclavian vein. Also, we're having like cephalic vein, that it is branch of the axillary vein, and together they are going into subclavian vein. So it's really easy, just what we edit here. Like location is almost the same, everything almost the same. However, we added basilic vein and we added cephalic vein, which is branch of the axillary vein, right? Okay. Do you have any questions regarding this? No? Okay. If you don't have any questions, then we're continuing with our arm. And as I've already mentioned, subclavian artery is becoming the axillary artery, and after that it is becoming the brachial artery, right? So the major artery of the arm is our brachial artery, and mostly it is found in our anterior compartment. It is beginning as the continuation of the axillary artery at the lower border of the teres major muscle, and it is terminating at the distal to the elbow joint, and there it is dividing into radial and ulnar arteries, right? So to see this photo here, this is our axillary artery. And after that, this is our teres major muscle, right? It is becoming the brachial artery. Here it is located like our elbow joint. And at the level of the elbow joint, it is becoming radial artery and ulnar artery. We will discuss today also radial and ulnar arteries. But before I will go to next slide and I will discuss, I want to highlight your attention to the biceps aponeurosis, and as you see, it is going above, right, of the brachial artery. Okay, just remember this picture. We will see once again this and many times, but this is really interesting point here. To see another photo more in 3D, so this is our teres major, and from the teres major it became the brachial. So it is going like this, and at the level of the elbow joint, we are having there cubital fossa, like this part in the hand. I will show you. This part where we're like moving the hand, right? It is cubital fossa, and beneath it we're having already radial artery and ulnar artery, right? So we are also having this schematic overview of this one here. I guess with these photos it would be easy to understand the location and how it is going in our hand, right? Okay. Brachial artery has branches. Branches of the brachial artery in the arm includes 2 adjacent muscles and 2 ulnar collateral vessels, which are contributing the network of the arteries around the elbow joint. So, and additional branches of the brachial artery are profunda brachii arteries, and mostly what their function it is to give the nutrients to the humerus. So this is exactly what I mentioned in this photo, and I will show once again. So we discussed the major, how the brachial artery is going, and as you see here, this is our profunda brachii artery, right? So this profunda brachii artery is supplying our biceps, giving the nutrients, let's say like that. Here. Another branch, and let's see another photo for that. Here. So this is our axillary artery, third part, and after that we are having the brachial artery, like this part here. And this is our humeral nutrient artery. Posteriorly we are having profunda brachii artery coming down, and profunda brachii artery are giving us radial and medial collaterals, and at some point at the elbow they are anastomosing. Also, one branch of the brachial artery, it is superior ulnar collateral, and it is coming down and going to the ulnar bone. Another branch, it is inferior ulnar collateral, and it is next to, like, above the elbows right ahead, and again it is after the elbow it is becoming anterior ulnar recurrent artery. So we will once again go through it, but just to discuss how the anatomy of the and blood supply of the hand is here. So to see once again here, we're having like cubital fossa is here. This is the brachial artery, and then let's see how it is dividing, like the radial artery or ulnar artery. That's what is important till now, and after that we will come back to this photo once again. So I mentioned profunda brachii artery, right? And as you already saw it here on this photo, profunda brachii artery, it is the major artery, like major branch of the brachial artery, right? And mostly it passes into and supplies the posterior compartment of the arm. Brachial artery is mostly located on the anterior surface. And itself, profunda brachii artery branching, and they are supplying mostly the biceps and triceps, and also anastomosing with the posterior circumflex humeral artery, right? And And which was, or which, can you remind me what was the posterior circumflex humeral artery? Okay, we will see a photo once again of it. So, as we said, like anterior and posterior circumflex humeral artery, they were part of the like branch of the third part of the axillary artery. Here, this is the axillary artery, and we are having posterior circumflex humeral artery, right? And from here we started the brachial artery, and this is profunda brachii artery, and they are anastomosing with the posterior circumflex humeral artery here. So it's going up, and its branches is going up, okay? Did you get the connection? Yeah? Okay. Let me go back to our slides. Yeah, I mentioned that one, so this is the same photo here. And as you see here, it is better shown, like without any muscles. The anastomosis of profunda brachii artery, and one of its branches is going and anastomosing with a posterior circumflex, humeral circumflex artery right here. Okay. Profunda brachii artery, it's continuing and becoming radial collateral, and also we're having here the medial collateral also. They are all anastomosing. Another branch, what I've already mentioned and repeating, it is superior ulnar collateral, inferior ulnar collateral here. So now talking about the veins of the arm, right? We are having paired brachial veins that pass along the medial and lateral side of the brachial artery, and they are receiving the tributaries that accompany the arteries, branches of the arteries. We are having their deep veins, and also we are having, in addition, two large subcutaneous veins, and these veins are basilic vein and cephalic vein, and they are located in the arm. We already discussed the basilic vein and cephalic vein, but once again to see that. So these are like subcutaneous superficial vein, basilic vein, and it is going up, right? So basilic vein also like penetrates the deep fascia at some point, and then it is becoming the axillary vein, right? The branch of the axillary vein, we already mentioned that it was like this big part, and it is called cephalic vein, right? So together it is giving us like the vein circulation, like venous blood supply circulation. Also, our basilic vein has its own paired brachial veins, and these are more deep located, right, as you see here. It is below the teres major muscle. Underneath, it would be more correct word here. Is it clear? Okay. So now let's continue with the supply of the elbow joint. So mostly the elbow joint blood supply, it is anastomosing network of the vessels derived from the collateral and recurrent branches of the brachial, profunda brachii, radial and ulnar arteries. And in the forearm, mostly the anterior compartment, the largest arteries in the foramen are in the anterior compartment, and they are straight ahead, going to the supplying of the anterior forearm, and they are also anastomosing and giving us the vessels and blood supply of the posterior compartment. And the major arteries and what we are having there, it is radial arteries, and we are having the ulnar arteries, right? So as you see on the photo here, this is exactly what I've been speaking about, like the brachial arteries is continuing with the radial artery, and it is giving branch of the also the ulnar artery, right? And it is coming till the hand. So, talking about the radial artery, as you see on the photo, it is originating from the brachial artery at approximately the neck of the radius and pass along the lateral aspect of the forearm, right, where we're having the radial bone. Radial artery in the distal forearm of the radius pulse can be felt if we gently palpate the radial artery against the bone, right? So, because it, as you see here, it is straight ahead going on the bone, so we are compressing the artery here, and we are feeling the pulse. So the pulse can be felt on the radial artery. Radial artery is leaving the forearm and then passing around the lateral side of the wrist, and it is penetrating the dorsolateral aspect of the hand between the base of the metacarpal 1 and metacarpal 2, and this is like the metacarpal 1 and metacarpal 2, and as you see, it is going straight ahead here, right? And also, radial artery is having their own branches that they are originating in the forearm, and these branches are radial recurrent artery, which contributes to an anastomosic network around the elbow joint and to the numerous vessels that supply muscles on the lateral side of the forearm. It has a palmar carpal branch that it is again anastomosing and mostly supplying the carpal bones and joints. And the largest branch that it is having superficial palmar branch. So let's see them on this photo. First one, we're having the radial recurrent artery, right? So this is our radial artery, and then we're having here, it's not mentioned, but let me see in another photo. Okay, so around here it is creating us like the anastomosis and supplying the elbow. After that, it is like the branching again and creating our like superficial palmar branch of the radius here at around the first and second metacarpal bone. Okay, do you have any questions regarding the radial artery? Okay, then we can have a break for 10 minutes and come back and continue with the ulnar arteries. Okay, guys, so now let's continue with the ulnar arteries. So we finished the branches of the radial arteries, right? So talking about the ulnar arteries are larger than radial arteries, and mostly they are over the ulnar bone, right? And they are passing down the medial side of the forearm. Ulnar arteries are leaving the forearm and they are entering the hand by the pisiform bone. And they are located superficial to the flexor retinaculum of the wrist, and also they are creating the arch over the palm. And sometimes it is like the major blood supply of the medial 3 and 1/2 of the digits. So as you see on this photo here, this is our like brachial artery, and we're having the branch of the ulnar artery, and then as I mentioned, it is going over the flexor digitorum profundus, and it is going inside the it is like over our flexor carpi ulnaris muscle, and it is entering the palm, right? And of course it has more branches than the radial artery had. So branches of the ulnar artery consist of the ulnar recurrent artery. It has anterior and posterior branches, and they are anastomosing and creating the network around the elbow joint. And as you see on this photo, right, this is our brachial artery, and it is continued with our ulnar artery, right? And what I mentioned was like our ulnar, anterior ulnar and posterior ulnar arteries, right? Recurrent arteries, and they are anastomosing with the superior ulnar collateral arteries also, and they are creating the blood supply for our elbow joints, right? Yeah, to see next photo, we will see here also not these arteries at all. However, we will see another like different part of the arteries. So another branches that our ulnar artery is having, it is a common interserous arteries, which are dividing into the anterior and posterior interserous arteries. And you will see this on this picture mostly. And this is the first branch of the common interserous like ulnar artery, and it is common interserous artery. And it is dividing into anterior interserous artery and posterior interserous artery here. And anterior interserous artery itself, it is branching into the perforating branch of the anterior interserous artery, and that's how it is supplying the most muscle of the forearm, right? And also the final branches that our ulnar artery is having, it is like these two small carpal arteries, and it is dorsal carpal artery branch and palmar carpal artery branch, and they are supplying the wrist. So to go on this photo, you will see our ulnar artery, and as you see, this is the carpal artery branch here, and they are creating like the superficial and deep carpal circles, and we will discuss this part in our wrist section that we will start in a few minutes. If you're having any questions regarding the ulnar arteries, feel free to ask, because we are starting the wrists right now. Okay, I don't see any hands. So talking about these really smallly about like the veins. Deep veins of the anterior compartment of the forearm are the same as like the ulnar arteries, and they are going in the same location where arteries are located. Yeah. And talking about the posterior compartment of the forearm, the blood supply of the posterior compartment consists of the branches of the radial, posterior interserous, and anterior interserous arteries. So we already saw from which parts in the anterior surface they are branching and how they are located. To see in the posterior part, once again, let's see anterior part. So this is the elbow, and here should be the ulnar artery, and like continuous of that will be the ulnar artery. And we are having the first branch, which is common interserous artery, branching into the posterior interserous and anterior interserous. It like in between of this posterior and anterior interserous, we are having like interserous membrane, and even the name implies where it is located, right? So this is the posterior part, and now to see on the posterior view, this is our posterior interserous artery, right? Here. And this is our interserous membrane, this part. Okay? I guess it's clear and really easy, because easy to memorize, because the name implies the same by the location, right? Okay, questions? No. Okay, then let's continue with the blood supply of the hand. So, blood supply of the hand is derived from the radial and ulnar arteries, which form two interconnected vascular arches. And these arches are superficial and deep palmar arches, and they are, as the name implies, located on the superficial layer of the palm and deep layer of the palm. And what they are created from the radial artery and ulnar artery, and mostly they are supplying all the digits. However, radial artery contributes like mostly the lateral side of the thumb, like the whole thumb, mostly lateral side, and also lateral side of the index finger. And other remaining digits are supplied by the ulnar artery. So this is the photo for that. So we see here that we're having the radial artery here over the radial bone, and we're having the ulnar artery over the ulnar bone, right? And we see above the bones we are having, and above the muscles, we are having the superficial palmar arch, which was created by the ulnar artery and radial artery, right? And also we're having deep palmar arch, which is beneath the muscles, and again this was created by the branches of the ulnar and radial branch, right? And as I mentioned, mostly radial artery is supplying the thumb. As you see here, branches are coming from the thumb, and the lateral part of our index finger. And ulnar artery is supplying the other, like medial surface of the index finger and other digits that are left. Okay? This is the same photo but more schematically viewed. So, and the hand is like vice versa located. So this was the left hand and this is the right hand. That's why the radial artery is on the left side. So this is the radial artery, this is the ulnar artery, and you see like superficial, then and superficial blood palmar arches giving us common digital arteries. And we're having the deep palmar arch that it is mostly supplying the thumb and also the lateral surface of the index finger, right? So I guess schematically you understood which is supplying what here. So the ulnar artery and palmar branch of the radial artery, as I've already mentioned, are creating superficial palmar arch. And this is our more in details without deep palmar arch to understand how it is supplying. This is, again, I will repeat one more time. And this is our superficial palmar arch. And as you see, we have here palmar digital arteries, right? This is palmar digital artery. And these both are like common palmar digital arteries. You can call it like the same way, either common or palmar one. Also, yeah, I will talk about the deep later. The same photo for that. So, as I mentioned, palmar digital arteries are like supplying from the medial side of the little finger. And common palmar digital arteries, they are supplying from the lateral side of the little finger, both sides of the ring fingers, middle finger, and the medial side of the index finger. So, common ones and palmar digital artery, right? Okay. Talking about the deep palmar arch, it is mostly created by the radial artery. And again, it is anastomosing with the terminal part of the ulnar artery. And the main difference with the superficial palmar artery is that it is formed predominantly by the ulnar artery. And as you see here, this is the radial artery, and it is creating the palmar arch, and ulnar artery, it is creating the superficial palmar arch, right? And mostly you can see here like this is like more above, and as you see, this is dorsal view, and you see how the dorsal carpal arteries are located. Then it is giving like branches of the dorsal metacarpal arteries here, and then comes like the digital arteries, right? So as it is located in the deep, it is named as a deep palmar artery. We are calling it like it is located, as the name implies, in the depths, right? And before penetrating the back of the hand, the radial artery is giving us two branches, like two vessels. And these are dorsal carpal branch, which gives rise to dorsal metacarpal arteries. And then they are dividing to become like small digital arteries, and they are entering the finger. And also we're having the first dorsal metacarpal artery, which is supplying mostly the index finger of the thumb. And to see this, we're having here. So as I already mentioned, this is our radial artery, right? And here we're having dorsal carpal arteries. Then we're having like dorsal metacarpal arteries, and then we're having dorsal digital arteries. And from this side, we're having the dorsal metacarpal arteries, and it is straight ahead supplying our thumb. Okay, do you have any questions regarding that? No? As we're having like plenty of time, for tomorrow, of course, you will not for tomorrow, for the next lesson, we will have the upper limb. But let's start today discussing the pelvis, perineum, and lower limb also, and their blood supply. So I won't start explaining where the pelvis is located. However, today we should discuss like the pelvic artery, pelvical arteries and veins. And if you remember, from thoracic aorta, then we're having the abdominal aorta, and after that we are having the iliac arteries, right? So that's the arteries that today we will be talking about. And the major arteries or pelvis are perineum is the internal iliac arteries, which are mostly located on the each side. And in addition to provide a blood supply to the most of the pelvic viscera, pelvic floor and walls and the structures, it also supplying the erectile tissue of the female and male genital tracts. And also these arteries give rise to the branches that follow nerves into the gluteal region of the lower limb. Talking about the iliac arteries, and let's see the photos at first, the iliac arteries. So we're having like here common iliac artery, and then it is dividing into the external iliac artery and internal iliac artery, right? And the internal iliac artery is having anterior tract and posterior tract, and after that it is branching, right? So internal iliac arteries, they originate from the common iliac artery on both sides of the leg, and not at leg, like around like the level of the L5 till S1, and it is going down to the sacroiliac joint and the anterior medial side. And at the leg area beneath the pelvic, it is becoming the femoral artery. So here once again, and you might see the L5 level right here, like it's a bit above, so you're seeing it here, and after that to the sacroiliac joint, it is becoming like the external and internal iliac arteries. So what is the course of internal iliac arteries? Because like in the gynecology and in the urology, when we're doing surgeries, this is like one of the most important arteries that we're handling. Also if we are having some kind of herniation of the lower abdomen, right? So first of all, the vessel course is like it goes inferiorly over the pelvic intel, then it divides into the anterior and posterior trunks at the level of the superior border of the greater sciatic foramen. The branches of the posterior trunk contribute to the supply of the lower posterior abdominal wall, the posterior pelvical wall, and the gluteal region. And branches from the anterior trunk supply the pelvic viscera, the perineum, the gluteal region, the adductor region of the thigh, and in the fetus even the placenta. So it would be nice if you would remember that, because this is like the quiz material. So as I mentioned, and I'm once again highlighting out that inferior to the pelvic intel, it is dividing into the anterior and the posterior tract at the level of the superior border of the great sciatic foramen. So it has two trunks, right? And let's start discussing the posterior trunk. So branches of the posterior trunk is giving us like two arteries, and it is iliolumbar artery and lateral sacral artery, and also superior gluteal artery. So I guess the name implies where they can be located, and let's see this photo. And we are having here first branch iliolumbar artery, right? We are having lateral sacral arteries here, this one and both of them. And the third branch, a branch that it is not quite visible on this picture, but we see a portion of it, it is superior gluteal artery. So 3 branches of our posterior trunk of the iliac arteries, right? So once again, we're having common iliac arteries. It is divided into the external iliac artery and internal iliac artery. Then internal iliac artery is having 2 huge trunks. It is like the anterior here, and we're having posterior, right? Posterior trunk, one of the branches is iliolumbar artery, then it is lateral sacral arteries in the plural form, and we're having here this small part, what we see is superior gluteal artery. Okay, so let's start discussing with the iliolumbar artery. Iliolumbar artery, as you see here, right, this one, it is ascending laterally back out of the pelvic intel, and it is dividing into the lumbaral branch and iliac branches. And the lumbaral branch contributes the supply of the mostly the posterior abdominal wall, psoas, quadriceps lumbarium muscles, and cauda equina with a small spinal branch that passes through the internal intravertebral foramen between L5 to S1. So here we are having iliolumbar artery, and this is the iliac branch here, and this is the lumbar branch, right? And lumbar branch is like this spine, having like this kind of small spinal branch, which is supplying the cauda equina, and it is really important to in neurology the supply of the cauda equina. Okay. Talking about the iliac branch, which is located here, this part, passes laterally into the iliac fossa and supplies iliopsoas muscle and the bone. Okay, talking about the lateral sacral arteries. So lateral sacral arteries, we are having usually 2 of them. They are originating from the posterior division of the internal iliac artery, and their course is going medially and inferiorly along the posterior pelvic wall. They give rise to branches that pass into the anterior sacral foramina to supply the related bone and soft tissue, structures in the vertebral sacral canal, and skin and muscle posterior to the sacrum. So exactly this is like, it's what I explained, like where they are located, these branches here. And the final one that we're having, it is like this 3rd branch that we can't see really well on this photo, this small one. It is like the superior gluteal artery, and it is the largest branch of the internal iliac artery, and is terminal continuation of the posterior trunk. So after that, we don't have any continuous of the posterior trunk. It even the name implies it courses posteriorly, and it is passing between the lumbosacral trunk and anterior ramus of the sacrum 1 vertebra. It is leaving the pelvic cavities through the greater sciatic foramen above the piriform muscle and enter the gluteal region of the lower limb. The The vessels make a substantial contribution to the blood supply of the muscles, skins, or mostly of the gluteal region. And also they are supplying the adjacent muscles and the bones of the pelvic wall. And here we finished the posterior trunk. Do you have any questions regarding that? No? Okay, so we will continue with the anterior supply of the anterior trunk, of the iliac tract. And anterior trunk branches into several arteries, and it is superior visceral, umbilical, inferior visceral, middle rectal artery, uterine artery, vaginal artery, obturator artery, internal pudendal artery, and inferior gluteal artery. So there are plenty of the arteries that are branching from the anterior trunk, and let's now see all of them. So this is our common, then internal iliac, external iliac, posterior trunk, and anterior trunk, right? And here we're starting. This is like our umbilical artery. And the name, like the easy thing to remember, it's like the names are exactly the same, how it is going. So you can easily understand that which organs it is supplying, right? So umbilical artery here, then we're having obturator artery. We're having also, like from the umbilical artery, we are having the branch of superior visceral arteries. We're having inferior visceral artery also. It is straight ahead the branch of anterior trunk. We are having like the inferior gluteal artery, middle rectal artery, pudendal artery, internal pudendal artery, and inferior visceral artery. So these are the main branches of the anterior tract. The final topic for today will be the veins of the pelvic cavity. So in the pelvic cavity, we're having like interconnected venous plexuses, and they are mostly associated with the surface of the viscera. And in the pelvic cavity, we are having like bladder, rectum, prostate, uterus, and vagina, right? So together, these veins are creating the pelvic plexus, and mostly they are supplying the rectal and anal canals, and they are draining into the superior rectal veins. And they, like where the arteries are located, they are located in the same areas exactly. And like these superior rectal veins are the tributaries of the inferior mesentery veins, and they are all going to the hepatic portal system via middle and inferior rectal veins, and then to caval system. This is like pelvic plexus is really important because we are having when we're having the hepatic portal system blocked, we are using a portocaval shunt, and that's why it is important to know. So let's finish here, and from the next lesson we will continue with the perineum. And your homework will be the upper limb, and if you will be able to discuss and read the blood supply of pelvis and perineum and lower limb, mostly like the pelvis, it will be a good. However, pelvis is not obligatory for the next lecture. Upper limb, it is obligatory. Thank you for today. If you are having any questions, feel free to ask.